advancing the work that we do in public health around the globe. So for today's session, I'm going to introduce each of our three panelists that are here with us today. And then I'll give kind of a brief overview of what we mean by transdisciplinary problem solving and transdisciplinary science. And then I've got a set of questions that I'm going to pose to my colleagues about their research and teaching. And then at the end, we have time also for students to ask questions. But at any point in this, if you'd like to ask a question in the chat, please feel free to do so. When we get to the questions for the panelists, we'll just keep this a really informal conversation. So if there's any burning questions that you have, please feel free to raise your hand or to put it in the chat or to come off mute and ask your question. We'd love to hear from you. Next slide. So I have the honor of introducing our panelists today. And the first colleague that I get to introduce is Dr. Ross Brownson. He is the Stephen H. and Susan U. Lipstein Distinguished Professor at the Brown School. And he is really thought globally as a leading expert in applied epidemiology and also dissemination and implementation science. He developed strategies in chronic disease prevention through translational research. He's named among the most highly cited researchers in the sciences by the Institute for Scientific Information and Stanford University Elsevier list. And I will say that not only highly cited, but just known everywhere. I tell people a lot that I don't, it's difficult for me to go to a national conference or meetings with the state health department. And when I say I'm at WashU, people will say, oh, so you know Ross Brownson? So, his areas of focus are chronic disease prevention through environmental and policy change and evidence-based public health. And like I said, also dissemination and implementation research. And he teaches courses in translating into epidemiology into policy and evidence-based public health. Our next panelist is Dr. Darrell Hudson. He is an associate professor here at the Brown School. He focuses on racial and ethnic disparities and the role of social determinants of health, and particularly how socioeconomic position and social context affect health and health disparities. His areas of focus and research are on racial and ethnic health inequalities, the social determinants of health, social mobility, stress and health, and also mental health. And he teaches a lot of different areas. He teaches a course in social epidemiology, health behavior and health promotion. And he's taught several transdisciplinary problem solving courses, one in pop culture and public health, and also one on preventing youth violence. And he's also involved at the med school and thinking about how med school students are receiving the same kind of education, thinking about social determinants of health as they progress in their medical training. Our last but not least panelist is Dr. Debra Salvo. She's an assistant professor here at the Brown School, and her area of research and teaching is around exploring spatial and place-based factors that influence physical activity and other health-related behaviors, focusing on elucidating the complex, context-specific relationships between the built environment and health. Her areas of focus are spatial epidemiology, physical activity research and capacity building, chronic disease prevention, global health disparities, and Latin American populations and US-based minorities. Recent courses that she has taught are epidemiology methods, transdisciplinary problem solving course, health and place, spatial thinking and applied methods. And Debra is also the chair of our epidemiology and biostats concentration specialization. So in a minute, we'll hear a lot more from our panelists, but I want to put this session in a little bit of context about what we're thinking about in public health. And one thing that I've learned from a couple of my colleagues, Ross in particular, and Debra Hare-Joshu, who's not here with us, is that they always have these really great cartoons in their work that they do. So I tried to do that as well. I think this cartoon actually might have been in something that Debra Hare-Joshu had done a couple of years ago, but to kind of describe the spirit of this cartoon is, a bunch of wolves that are howling at the moon, and that colloquialism, howling at the moon, it means, what we're doing, is it really making an impact? So, one of the wolves are saying, my question is, are we making an impact? And I think that's what we try to determined in public health and something that we want to avoid. We don't want to feel like we're just howling at the moon, and no matter how much noise we make, we're not going to change the lunar phases, right? So how do we really make the most impact in what we're doing? And we know that we have to do that through a transdisciplinary lens. Sarah, if you want to go to the next slide. And so some definitions and context for that is, thinking about transdisciplinary science, thinking of it as a field of research that focuses on distinctive, substantive concerns and emphasizing particular analytical levels, theoretical concepts, and methods. And we can kind of look at that in this graphic here with the two Venn diagrams. On the top, we have multi and interdisciplinary. You can see these three disciplines, having a little bit of overlap there. They define a problem and maybe some shared methods. But if we compare that to the bottom graphic, the bottom Venn diagram, where we have our three disciplines, they're really coming together in a more coordinated way. There's a lot more overlap. They are defining a problem, shared methods, and policy solutions in novel ways that maybe, they aren't doing on their own. So it's really thinking about a shared conceptual framework and really creating novel ways to address some of our most, what we like to call our wicked social problems, our big public health problems, where we know that even if we are classically trained in public health, we aren't the only discipline that can address these problems in an effective way. So transdisciplinary problem solving is really multiple disciplines working jointly across this shared conceptual framework that draws together the discipline-specific theories, concepts, and approaches to address that common problem. And like I said, coming up with novel approaches to it. So with that kind of context and thinking about, how in public health we can be much more effective, we're not just howling at the moon, we can be a lot more effective whenever we're working with other disciplines. I think I'm going to stop, or we'll stop sharing the screen, and then I'm going to start by asking the panelists a few questions. And my first question, any of us can answer, any of the panelists can answer. So the first one is, as a public health scholar, how would you define the problem your work is trying to solve? And how do you engage or collaborate with other disciplines or fields of study to define and work on that problem? So, go ahead, Debra.
Thank you, Angela. Thanks for the question and for having me here today. This is a good question, since I work in a field which sometimes even a subfield within public health, that even some of my public health colleagues that do a bit more of the traditional sort of clinical outcomes are surprised that my entire career is focused on physical activity epidemiology and studying a health behavior. And then within that, I focus on understanding how the built environment of where people live influences this behavior. So I try to define the problem that I'm trying to solve as, everybody knows that here in the US and pretty much anywhere in the world, your zip code defines more your health outcomes that you'll have later in life and your economic outcomes and other social outcomes more so than your genetic code does. I want to solve that because to me, that is reflective of a disparity, of an unfairness. And I want to understand how we can make places and neighborhoods and environments good for everybody to thrive and to achieve their maximum potential health-wise and otherwise. That's how I would define it. Can you repeat the second part of your question, please? Sorry.
Sure. Yeah, so the second part of the question is, how does your work engage or inform or collaborate with other disciplines?
Yeah, thank you. And that one really resonates with me too, because at least for the health problem I study, physical inactivity, about a fourth of adults globally don't meet minimum recommendations for physical activity to maintain our health, not even to improve it. And that's a problem in many ways. But physical activity, at least, is a problem that won't be solved mostly by the health sector. We need to engage with all sorts of sectors, geographers, transportation people, recreation people, parks and rec, et cetera, all the venues where physical activity in our daily living happens. So it's a very natural sort of thing to do to start working in a transdisciplinary fashion. And what we call physical inactivity as a public health problem, somebody else will call like unsustainable or non-clean travel forms, for instance, that they need to solve as like promoting sustainable travel. So we need to find that common language too.
Great, yeah, thank you, Debra.
Thank you.
And I'll ask Dr. Brownson or Dr. Hudson to answer next, but it looks like we have a question maybe from a student. Dr. Kumar, did you have a question that you wanted to ask?
Good evening, everyone. Right, I don't have a question. I want to answer the same question which you asked in my way. Can I go ahead?
Sure, that's fine.
Okay. Actually, I'm working on oral malignancy in the groundwork. What I see in my area, that people are there, their education is low, they are less aware, and they come with the oral malignancy in third stage or fourth stage. At that time, it is difficult for a big clinician to manage that malignancy or to treat that malignancy. Generally, the stage 1 malignancies are best curable, and we can provide the best support. But what we see, the major population come with grade 3 or grade 4 type of oral malignancy, either breast malignancy or cervical malignancy. So for that, working in ground, what I see that how to define the problem. The first question in that we see we collect the observational data from clinics, the tip of the iceberg. Then we try to dive into the base of the iceberg, where this population is, where the problem lies in the ground. So we move to the ground. There we see that there are population with most of the population with grade 3 or grade 4 malignancies. So this was the problem sorted out. Now the difficulties, what the roadblocks are there, that is poor status, socioeconomic status. Thereafter, there is illiteracy prevailing in the area, lack of awareness in that area, that how these malignancies are treated. So these are the roadblocks. Now, what are the engaging fields which I can collaborate, which we generally doing is that we are taking help of social work people, the social influential people like Mukhya, Panchayat, local leaders. We are training them, and we are asking them to motivate their people. Thereafter, we are planning social activities like some of the religious activities. We are indulging these awareness things. Thereafter, we are playing the medias. In media, we playing the awareness things that people should report these things at the earliest stage. So likewise, we are collaborating the other field also, and we are getting a good outcome right now, that most of the people with grade 1 malignancy are also coming to the OPD. Thank you.
Great, thank you for sharing. Yeah, and it sounds like in your medical profession, you've had to think a lot about how to kind of provide a blanket of support for patients who are dealing with cancers and malignancies, and what that means in terms of social networks and social issues. So thank you for sharing that perspective. And Dr. Brownson and Dr. Hudson, I'll turn it back to you and ask you the same question. How do you think about defining the problems that you are trying to address, and how do other disciplines kind of inform, or how do you engage other disciplines in the work that you do?
Darrell, why don't you go ahead? I'll go last.
Okay, sure. So first, thanks everyone for being here this afternoon, and or evening or morning, wherever you might be. And thanks to all the organizers. So at the center of my research agenda is thinking about how to achieve health equity. And so that's a really unwieldy, difficult question to tackle, and it requires a transdisciplinary lens to do that. So I often engage with people in disciplines, literatures that are in sociology or economics, this broad umbrella of population health, demography. And again, we're all trying to figure out what are the kind of core fundamental causes of population health inequities? So we have to think deeply about policies and histories and context. So some of the things that Debra just mentioned in terms of space, and space is not by accident, space is by design, especially in the United States. So we have to think about why is space situated the way that it is, what policies and practices, attitudes, norms, et cetera, are responsible for the spatial layout. And of course, health promoting resources are embedded in those neighborhoods. So we have to think about that. So that requires me to think about space quite a bit. It requires me to think about housing policy. So again, engaging with policy experts or people who understand history. And so that's the core of it. I would say one of the challenging things for me as a person who's interested in health equity is that a lot of times the fundamental, what we think about quote unquote fundamental causes. So issues that are undergirding multiple health outcomes are kind of similar. We're thinking about poverty, we're thinking about racism, we're thinking about these broader social conditions, and our fields are still oriented around a disease framework. So a lot of times we're always thinking about, it's disease X, Y, and Z. And a lot of the core determinants of health impact all of the different diseases. So I would say that's a challenge. Again, that requires us to engage with a lot of different disciplines to answer that complex question. So I'll stop there and hand off to Ross.
Thanks, Darrell. So the good thing of going last, I can just sort of layer on the great things that were already said. I think I want to have you all, hopefully all of you, our incoming students, think about a couple of questions that goes back to what Angela said. One is, what will impact mean for you? In other words, over your career, what difference do you want to make in this world? And how does that fit in? And it's not a little question, but it's one that's always worth visiting, and one we'll visit often when you're here with us at the Brown School. And then how beginning a career in your graduate training, how can we help you on that voyage and get that launched? I came at this pretty non-traditionally. I did more traditional things of studying epidemiology. A lot of my early work was in etiologic research, things like, does exposure to secondhand smoke cause lung cancer in people who don't smoke? Led to smoking bans that we now take for granted in most parts of the world. I then worked for 8 years in a state health department. So that was sort of a different way to do what an academic person usually does, which is go into a postdoctoral training fellowship or directly into academia. And I learned a lot about evidence-based practice, what doesn't work, how to work with legislators and governors and a lot of different policy settings. And then moving to academia, moved away from etiologic sort of work, more toward intervention work. A lot of my work has layered with Debra's work in physical activity promotion and interventions. And I would say this last round has been focused mostly on this field that Angela mentioned, we call implementation science. The famous statistic we use that it takes 17 years for 14% of original research to reach patient care or public health practice. So 17 years for 14% of research. No one can argue that's doing good enough. And if you think about what Darrell and Debra were alluding to, health equity issues, it's even more years and a lower percentage. And so we have a lot of work to do. We have a lot of knowledge about what needs to happen, but we're not applying what we need to do. And that's really what implementation science tries to do. And we have a really great teams of people working on that here at WashU across both what we call the Danforth campus, which is the campus where you would primarily hang out, and the medical campus, which is on the other side of a beautiful urban park called Forest Park. And there's a lot of work to do. I think there's also a lot of hope in the field right now. Funders, even policymakers in some settings are taking the social determinants of health more seriously. There's more and more funding for these kinds of issues that Darrell alluded to that really are the underpinning issues. It isn't just that there's a new primary care clinic in a community if people don't have the transportation to get there, or if they are making minimum wage, and if they take the time, they have to lose half a day's wages to go to a clinic. And so there's a lot of things that have to intersect with public health practice to make it work. And I often say most of the the gains we'll make in health, life expectancy, reducing of inequities is going to come from sectors outside of health. So this idea of transdisciplinary problem solving or working across sectors isn't a trivial thing, and it really is important. And it's not easy, but it's doable. It takes a little more time. It takes some different skill sets, and that's a lot of what we try to do here at the Brown School. So I think I'm hopefully answered most of your questions, Angela.
Yeah, I think so.
Yeah.
Yeah, it's great. And I think in a little bit, we'll get into what some of those skill sets are that we hope for our students to learn while they're here. So thanks for mentioning that. And I think kind of, similarly in thinking about working with other disciplines, it'd be interesting to know from you all if you have worked with other disciplines or areas of research. I think in public health, I would think the thing that I tell students in public health is that public health is so vast. I mean, you can talk about anything and pretty much make a connection to public health. And sometimes our careers take us on trajectories that were not quite traditional, like Dr. Brownson said, or get us into some work that we weren't quite expecting. So I'm wondering from the three panelists if you have worked with other disciplines or in areas of research that you really didn't have any intention of whenever you first started your work, but your path led you to working with that discipline, and if anything surprised you about that collaboration.
Well, I could start off. So I would say one of the unique things about being in the Brown School is I'm not trained as a social worker, but I ended up working quite a bit with social work faculty. And so when I first got here, I heard about wonderful people like Ross Brownson and thought those would be my natural collaborators because those were people who were rooted in the same discipline. But as I got here, and especially as I got more interested in certain types of intervention work, I found that working with social work faculty was really easy and one of the things that really enhanced the work that I was doing because they had skills that I didn't have. They had a lens that I didn't quite have. So I think that's, again, a great thing about transdisciplinary work is you can borrow from different fields, different perspectives, different theories, different expertise. So that's one that I can think of off the top of my head that's been really fruitful.
Great, thank you.
I'll tell one story. One of the projects we worked on, I guess it's been about 10 years ago or so now, down in a town called Piedmont, Missouri. We built 30 to 40 walking trails in rural Missouri over the time when with my research group, which includes Debra. And there was a town called Piedmont, and the mayor there wasn't really interested in health, but he was very interested in trying to connect different parts of their town or their city. I think there's like 6,000 people. So it's a small town place. And so he said, he wasn't getting at a health thing, but he wanted to connect the businesses. He wanted to connect schools. He wanted to connect the parks that were there. And so we helped them writing grants with people who were really out. It was transportation money. It had very little to do with health, but what it allowed was now they have a whole network of trails through their city or their town. They call it a town that connects all these different points. And, I'll be honest, there's a health department there in the town, but they weren't really that important to the process. It was really the mayor's office. He had a county clerk who was a go-getter person, and she really helped a lot. And so a lot of it, the friends come in different flavors that you don't always think of when you go on, because I never would have thought of, if you met him, you would not see him as sort of the picture of health. And so you come at things with different angles and you try to find common ground where he solved the transportation and connectivity issues that he wanted to solve. And we helped to build a whole network of trails that are going to be there probably forever. And so I think that's the great thing. And the more time it takes is usually finding that common ground to find out, well, maybe health isn't the number one, but your goal aligns with the health goals. One of the things that is great about you entering this field is if you poll any group of people, health is always going to be on their top 5 list in some form or another. And so there's an intrinsic motivation around this issue. But there's a quote that I think originally came out of Canada, and a document called the Lalonde Report that said we have, and to quote the WHO uses a lot, we have to make the healthy choice the easy choice. And what we've done in most parts of society, especially for populations that experience inequities, is we've made it difficult for them to be healthy. And so the pathway to getting healthier is making it easier. And when it's easier, people will choose the healthy option, but we have to make sure we open those doors.
Great, thank you.
I guess it's my turn. Thank you for the great examples. I guess I'll talk about a couple of examples, and I'll try to be efficient with time, but both of them refer to some of the work that I started since I came here to WashU, which I still find my move here pretty recent. I came here in 2018. So one project is still ongoing. Thanks to the pandemic, it got extended, and it's at Forest Park that Ross was referring to, which is a really beautiful urban park here. And I don't think that even a few years back, having done studies that referred to the influence of public open space on physical activity and mental health and other health behaviors, I don't think I ever expected that, for instance, my funders, instead of being the NIH or similar organizations, would be a foundation that's in charge of a public local foundation that's in charge of like enhancing and beautifying a local park. And they have been, they are funding a study that I consider to be a public health study. They consider it to be a different thing, an evaluation of park use. And the whole thing that brought us together is they want this evaluation done because they want the park to become an asset that is equitably used and accessible to anybody in the St. Louis metro area, regardless of race, ethnicity, income, et cetera. And anecdotally, they felt that that's not how the park is being used right now. I saw this as a possibility to do some good public health research in terms of the impact of resources like this on health, on physical activity, mental health, and equity type outcomes. So it's been a wonderful partnership, and one that I wouldn't have imagined a few years back in terms of who would be funding my research and the types of questions that I'd be asking within my research. Because you have to sometimes, you may have your, as Ross was saying, your main outcome of interest, physical activity in my case, maybe some mental health questions, outcomes, but then sometimes when you work transdisciplinarily, you have to think of what that win-win gives you. So you need to also become an expert in assessing and measuring things that may be the co-benefits for you, but the main benefits for another group. So that's a really good example of a fruitful partnership that I didn't anticipate. And another one that I like to tell people about, I just never imagined, as a very quantitative person and very public health oriented person. I'm working with a colleague in the political sciences department here at WashU. And we were funded internally to conduct a study across 4 Latin American countries to understand how political ideology and messaging and these types of things has impacted the management and response to the COVID-19 pandemic in these 4 countries. So I come in with the public health side and the epi side for COVID-19, but I would have never imagined that my exposures of interest would become political ideology and those types of things. Not that I don't find it interesting, but it's one of those things where even with all my imagination, I didn't see it going there. And it's been a wonderful collaboration. And it's good for public health and it's good for political sciences.
Great, thanks. And I'll just add to this something that I'm currently working on. Hopefully it will be fruitful, but with some other faculty on campus, it's something that's initiated by some anthropology faculty who are really interested in how culture and cultural norms can inform climate change policy, right? And so they are, coming together feeling as though that sometimes culture is not, and the understanding of history of culture is not really considered when we're thinking about the technological advances of climate change action. And political bodies are not necessarily always taking that into consideration when thinking about how to adapt to climate change or how to respond to climate change. So they have pulled together some of us in public health and engineering and anthropology to think through some cross training of our students and how we can really inform some of the technological approaches from engineering and the public health aspects from us, and then, include cultural anthropologists in the conversation too, because they feel like they have, and they do have a great understanding of some of the history and culture that can be really impactful and meaningful whenever it comes to implementing climate change policy. So, I will also, say that was a surprise to me, to think about, well, yeah, that makes sense for anthropology to really be at the table too. And there's some great opportunity for some cross-learning and research in those areas. So hopefully we, can get this grant up and running to have these training opportunities. Okay, so let me turn to the next question, and maybe less so about research and collaboration, but let's turn a little bit to our teaching. So I want to ask the panelists, what is your favorite course to teach, and why is that your favorite course to teach?
I'll do this one. This is sort of like being asked to choose your favorite child. So there's
right.
Not really a good answer to this one. I think I would choose the one that Angela had listed first, the translating epidemiology into policy, because it's not a sort of an epi methods class. We do talk about, study designs for evaluation of policy and some of the differences between standard epidemiologic designs and policy. And the big difference there, of course, is, well, number one, policy is one of the most important drivers of whether people are healthy or not so healthy. And it's a big part of our lives, even a visible part of our lives every day that we don't even think about. And number two, you can't study it or evaluate it the same way, because in a typical study, you can control what we call the independent variable, the exposure to something. In a typical study, you control that exposure, and policy more happens. And so you do what we call natural experiments to study it. And so we learn about that. And then we have some really great guest speakers come in. We have some real examples. I have a state senator come in. I have people who have been working for years on Medicaid policy here. We have people talk about global health, which of course the last couple of years has focused largely on COVID. But we focus on a number of different issues. And then we do some examples of hot topics that students want to talk about. And then we take some topics and we have debates about those, especially things where there's not a clear-cut decision to be made. What would be an example? Should high school football be banned in the United States? Well, you think about that. There's head injury issues, but then there's other cultural values that come around things like sports in youth. So we do things like that, and it's a really interesting class, and it comes usually toward the later part of people's time with us. It's a second year course, and it lets people think about a little bit more of the application. And what I want to get people excited about is doing something in policy, even if you're not going to be a policy practitioner or we've had people from the Brown School get elected to office. We've had them become legislative aides and work in the policy setting. But even if you don't do that, we all have to play some role in the policy process. And so thinking about sort of a policy continuum and where every one of our graduates can fit along that policy continuum is something I try to do. So that's the one I would talk about.
Great, thank you.
I can chime in. My favorite course to teach is social epidemiology, which I'm teaching in 20 minutes or so. And so I like that course because it aligns with my interests and passions around social and economic determinants of health, and thinking about ways to reduce racial, ethnic, and socioeconomic inequities in health. So it's usually an elective course, and it's a smaller class, which gives me an opportunity to interact with students and get to know them a little bit better. The readings that we provide are really in depth, and so a lot of the core, a lot of people know now what social determinants of health are, but we challenge some of the nuances there. So how do we measure things like social class and socioeconomic status, and why does it matter for our studies? How is race conceptualized? And we hear race as a social construct. What does that mean? How does race function differently across space and time? So we spend a lot of time diving deeply in some of these core social determinants of health and thinking about, again, how all these broad social conditions are undergirding multiple health outcomes. So I would say that's my favorite course to teach.
Great, thank you, Darrell. Deborah.
Yeah, I'm struggling because I teach 2 courses here, Epi Methods and the Space and Place TPS course. And I honestly really like teaching both. I would say if I had to choose, I'd go with the TPS course, Space and Place Applied, Spatial Thinking and Applied Methods. Mainly because I got to design that course. And what I do find unique about the course is when I was in grad school, I would have loved to take a course that sort of compiled all of this information and helped you become a spatial thinker while giving you some actual methods to use that. There were GIS courses and there were courses on social epi and other things related, health geography. But I hadn't found really a lot of examples from other universities of people that are teaching everything sort of together, because spatial epi, as applied to modern public health, beyond things like infectious diseases, which obviously is very relevant right now, but it's a new field. So it was really fun putting it all together and making it my own. And I think students have enjoyed the course. I've had really good feedback. But that said, I also, even if it sounds a little out there, Epi Methods is a core course for the epidemiology biostatistics specialization. And it's, as it sounds, it's methods. But I really like teaching methods. I think that if you have a very good foundation in methods, then you can do whatever you want and answer the questions you want in a way that's rigorous. And I especially like the challenge sometimes of, I know that some students are there that didn't elect to be there. It's not an elective, but the challenge of getting everybody excited and comfortable with the methods is, I personally enjoy it. And I'll also be teaching it in about 20 minutes. Sorry for my non-answer. It's almost a tie.
Yeah, well, I think that's good. I think it's good that we have, trouble deciding which are our favorite. I think that says a lot that, we enjoy the teaching aspect of our job. And I know, that's what I love, teaching is my favorite part of my current role. I think, just that connection with students and the whole learning process, both ways for students and for me is very energizing. So I hope others, feel that way as well. I'm going to ask the panelists one more question before turning it over for any student questions. But Dr. Brownson talked earlier about skills that are needed. And what are some of the skills that you think our students really need, in the 2 years or maybe 3 years if they're a dual or joint degree student that they're with us? What do you think they really need in today's public health world? What are some of the skills that they need to go out and be effective public health leaders or researchers, practitioners? And maybe what are the skills that really can help them think about how to address things with a transdisciplinary focus?
I can take a stab at this, and I'll give a 2-part answer. The first part is a little bit more on the more traditional and obvious side of things in terms of try to learn during your program, try to take advantage of the skill building courses, the skill labs here in terms of learning how to code. Data sciences have become a very big part of public health, and a lot of the different tools that exist, get proficient in them. So that's sort of the obvious part of the answer. That said, I'm not that old. I was in grad school not too long ago, well, maybe a decade ago, but a lot of what I learned in terms of those skills is now obsolete. So it's more important to learn, I think, the second part of my answer is, I guess the way that I'll put it is to speak different languages. And I'm not talking about English and Spanish and French, although that's nice to have too. But what we were talking about, the transdisciplinarity, one of the hardest things for achieving real transdisciplinarity in team science versus just having 2 people that sort of work together in a similar problem but approach it in very different ways is that sometimes we are actually talking about the same thing, but have very different terminology and different ways of describing the problem and approaching the problem, and different names for the same methods sometimes. So I think being comfortable in stepping outside of your comfort zone, and one thing that you can do is just taking courses that you think don't really speak to you, not entirely, it's not building your entire program around those, but making sure that each semester you have one of those is a tip I got from a mentor way back when, and I think it worked fine. But that to me, these types of soft skills are very important. And also with that, with the learning the other language comes sort of a side of don't be arrogant. I mean, we all think here that public health is the best and whatnot, and it's the public health problems are the most important problems, but they're not for somebody else. As Ross said, thankfully, they do rank for most people in a top 5 list, which is a good start. But we're not the top 1 problem for people. So I think acknowledging that the way of doing things, of speaking about things, the lingo, everything is different but equal, is very important for successful transdisciplinary work, which I do think is key for any modern public health scholar, person, practitioner. Yeah.
Thank you.
Yeah, just to build on some of the things that Debra mentioned. Obviously, coursework is really important in maximizing the skills that you can gain access to. I think some of the things are more global, I would say, like adaptability. So like Debra mentioned, you have to be able to, because pretty quickly the field moves so fast in technology and our understanding of methods and the programs that we use, et cetera. Things move so quickly that it can become obsolete. What you learned in classes can become obsolete in just a few years. So you have to be adaptable. You have to have a curiosity, a thirst to learn. I think that's really important. I think there is no substitute for experience. So once you walk out of the door and start to gain experiences as a professional, I think that's really important. In addition to what you do while you're in a program. So building relationships with faculty, working with faculty if you can on research projects or practice projects. Those are things that employers will want to know about because they won't care as much about what courses you've had. Unfortunately, I know we're talking about coursework and how unique our coursework is at the Brown School, and that is true. But when you get to employers, they won't go through your transcript. They'll want to know, what have you done with this stuff? And so the more you can do as a student to get experiences and exposures to talk about what you've done, how you've implemented and applied things that you've learned in a classroom experience. So I think those are some of the things that I would say, including, some of these, I wouldn't even say they're soft skills like time management. Everyone is stretched to the max. So how do you prioritize? And people will care a great deal about that. And now that'll also have a big impact on how your work-life balance looks like. So how do you prioritize? How do you structure your day? Which time of the day are your maximal hours, et cetera? Thinking about those things, especially inside the safe space of a school setting, is really important.
I'll layer on. I had 4 things that I think will just layer on top of what Devin and Darrell said. I had one of these, I think, is learning how to affect. I think about this, how do I explain what I do to my mom? Being able to communicate what you do to non-experts in real terms that will affect their lives, not in the sort of scientific lingo that we tend to learn in academia. So, and that can lay out by sector. So that might be a public health practitioner. It might be a member of the general public. It might be a policymaker, thinking of this concept and communication of audience segmentation and how you communicate those different audiences. We tend to be really good in academia communicating with other academic people, but not always so good at communicating with others who don't get all of our fancy terms. And sort of Debra said that. I think the other is what you'll learn a lot of here. How do you work across sectors? How do you make this whole transdisciplinary thing work and happen and make it real? The one, networking, building a network, and not just a professional network, but a network for yourself of mentors. I had a student contact me last week that was 25 years ago that I was her professor. And, had she not stayed in a little bit of contact with me, I might not have even remembered her, but we're linking up on a project. I'm helping her with some contact. So stay in touch with your, not just faculty people, but others who will be part of your network, peer-to-peer networking, as well as other mentors, other people you can learn from, and also that you'll help teach them about things. And so think about a sort of a reciprocal way of that mentoring. And then the other one I was going to add a little different is learn about negotiation. We see the world a certain way and we think the world ought to be our way, and maybe that's the right way it should be, but there's our world and the real world. And so where do you kind of reach that? This is one thing I try to teach in my course. I have people, we do a political ideology survey of the class, and then I have about an 800 person similar survey with state policymakers. And as you can imagine, your ideology on social issues and fiscal issues is just a little bit different than your average state legislator. So if you're in a negotiation, you've got to try to find that middle ground where, a social determinants lens for them might not do it, but maybe a cost saving lens, or maybe a livable lives lens, or something else. And so thinking about those terminology issues and how to frame things. So that relates both to a negotiation thing as well as a communication thing. And I agree with Darrell. I like the accreditors tend to call these soft skills, but in the real world, they might be more of the hard skills. They might be actually more important than whether you're analyzing your data correctly. And so, think about these as what I would call really essential skills. And I think the skill labs we have here and the other ways of learning can help you really build those.
Great, thank you so much. I was going to put that in the chat. I held off, but thinking about, we term these things soft skills, but they are actually the harder ones to learn and get experience with, but equally or maybe even more important than some of our technical hard skills. So this is really great advice. We've heard some really great perspectives on research and teaching. And I have a couple of other questions, but I'd like to take a little bit of time for our students to ask some questions, maybe something that you heard here that you want, more information on, or maybe something that you haven't heard here that you'd like to have some information on from our three panelists. So if anyone has a question, now would be a great time to, like I said, you can either put it in the chat or raise your hand or just come off mute and ask your question. No questions? Well, before I ask additional questions, maybe I'll ask the panelists, do you have any questions that you want to pose to our admitted students?
I like to ask people sort of there'll be so many opportunities for you at the Brown School and WashU. There'll be I call it the bright, shiny object syndrome, that there's going to be a lot of bright, shiny objects thrown your way, a lot of opportunities. Which class do I take? Who do I work with? How do I build this? It was sort of this time management thing that Darrell alluded to. I think, I don't know if this is a question because it's a really hard one to answer, but what are the ways you'll sort of prioritize things and make use of picking the bright, shiny objects that make sense for you, especially, the first couple months you're here when there'll be a lot of, for those, especially those, most of you moving to St. Louis, make the best use of that time early on so you can really launch your time with us for the couple of years really well. I don't know if that's a question really, Angela, but it is one for people to think about at least.
Great, thank you.
A question I'd really ask each of them is sort of what got them interested in coming to the Brown School in the first place, but that might be longer than we have in the next 6 minutes.
It might be, but it's a great question. So if anyone wants to answer that, feel free to answer that. And I had a similar question. We get students and our faculty too. I think what makes us, special at the Brown School is that, we are three different programs: social work, social policy, and public health. But even within public health, we have a lot of training in, vastly different areas. So I think at one point within the Brown School, we we had faculty with 36 different degrees, economics, education, social work, psychology, public health. I'm sure I'm missing quite a few there, but I'm just wondering if there's anyone here who has an undergraduate degree or has worked in different fields, but now you're interested in public health, and how what you've learned in your other field is kind of informing what you want to do with public health. Yeah, Fabi.
Hi. So my background is pediatric dentistry, and I love working with children. I worked with them a lot and treated patients. And I actually had a question very similar to what Dr. Brownson asked, which is, I have several interests. Like, I'm interested in childhood obesity, childhood nutrition. And after listening to Debra, I'm interested in environmental health also. Insecurities, like all these topics, I find them, I want to work in everything. So how do you, in the process, of the program, how do you select or how do you decide in the end who you're going to work with? I mean, that's my question. But I guess it takes time.
Yeah, it takes time. And also you might find that while you're in the program, you might take a class where you think, oh, I didn't realize that this was a thing, and I'm really interested in this now. So, and that's okay too. Our interests can change over time, and they often do. But, I think we have a lot of resources to help guide students at the Brown School. So, we have kind of our 3-tiered approach to advising. You have your academic advisor who can help to sequence courses and make sure you're taking the right things within your specialization. And then you'll also be assigned a faculty specialization advisor. And as our panelists were talking about earlier, it's so important to build those relationships and start networking early. So, even before you're assigned that advisor, reaching out to faculty that you might want to just know more about their work and what opportunities they might have. That's certainly, a great way to start building those relationships as well. And then your faculty, your specialization advisor can really help you think through those opportunities and things that might be of interest to you. And then the third layer is our field faculty advisors, and they can help connect you to things that you're really interested in for doing for your practicum. And can, and while you're in practicum, and that's such an amazing learning experience for our students. And oftentimes students come away from their practicum with even a better or clearer idea of what they want to do or don't want to do. That's a learning experience too, right? And also just a really great way to start building those networks. And we have quite a few students who will end up, getting employed because of the practicum that they've done. So I think, it's just a whole host of ways to try to figure out what makes most sense for you and what area that you want to focus on when you finish your education. And Ross and Debra and Darrell, if you have more to add to that, please do.
Only one quick thing, Bobby, if you have the time to work as a research assistant on a project, just be really open to a variety of things. Maybe you work 5 hours a week with someone, maybe it's a nutrition, maybe it's obesity, maybe it's something else, because you'll get a skill set and you'll learn something no matter what. And so if people can squeeze that in their schedules, I realize schedules can be really tight. It's really great. You learn from new people, you learn in a different way because it's really applied learning. And you often get to work closely with one or more faculty members. In our center, it's often with project managers as well, who are great. So I think just take an opportunity and try not, your first semester, try not to do too much. And Angela, I think Nandu might have had his hand up, right?
I saw that, and I think we might have time for one last question. Nandu, I don't know if you want to ask.
Yes, good evening. So my question is that I'm more concerned about the data discrepancy, because those population, particularly those who belongs to low socioeconomic strata, so it's very difficult to reach them, and that's why whatever data we have, that is already undermined, and particularly in contrast with the cancer. So only we are having only 7% of cancer patient registered in cancer registry. So how can we reach those populations so that we will have some evidence-based data to frame out some that lower strata population centric policies, and what are the opportunities in Brown School? Thank you.
Yeah, that's a great question. I don't know if I have a really great answer for such a great question. I'm thinking about, the type of cancer surveillance that we do here in the United States probably looks a lot different than cancer surveillance in other countries. We have mandatory cancer surveillance reporting systems. So that looks different elsewhere. And so I'm not sure that I have the greatest answer for how we get great data surveillance for those with low economic status who are battling with cancer. And that might be something that we discuss in coursework. And I don't know if Ross, if you have any insight into where he could get a little bit more training on helping answer that kind of question.
Yeah, I think it's a really great question. It's one I think everyone is grappling with. And I think there are, so in the cancer world here, there's the Siteman Cancer Center you might know about that is part of the NCI, the US National Cancer Institute set of comprehensive cancer centers. And there's a very large group of people working in that cancer center who is trying to address a lot of the issues you just raised, Nandu. Those are great questions. And in some ways that's a career's worth of questions, but we don't want to wait for a career to see these things addressed. So it'd be great things for you to work on while you're here.
Yeah, thank you.
All right, well, we are right at 1. I know our two of our panelists, at least Debra and Darrell, have classes to get to, and I know that you all have some choices for things to do this afternoon as part of Admitted Students Week, but I want to just thank Dr. Salvo, Brownson, and Hudson for spending this time with us and answering these great questions and providing these insights. And Sarah, I'm going to turn it back over to you if you have any last bits of information for our admitted students for what's next.
Really just want to echo the gratitude. Thank you so much, Dr. Brownson, Dr. Hudson, Dr. Salvo, Dr. Hudson. Truly just very much appreciate your time, your expertise, your insights. And we do have concurrent sessions this afternoon, so we hope that we'll see you at one of those, and then sessions wrapping up tomorrow to end Admitted Student Week. So thank you all again. I hope you have a wonderful rest of the day.
Thank you so much for being here. Bye.